Hello, my name is Lin and I'm a Tantra therapist working with pleasure, sexuality and spirituality to enhance your experience of life. I want to speak about something that I find really fascinating and that is really important for me. And that is the relationship to your yoni as a woman and the tremendous potential that your yoni has. I started to become interested in the yoni when I gave birth to my first child. Just like most of us, the images I had of giving birth were of a woman in pain, a woman in agony, lying in a hospital bed screaming for help. That's what I would expect from my own birth giving. However, my mother had told me that giving birth doesn't necessarily have to be painful. So when my delivery started, I was surprised not to feel any pain. On the contrary, I became very centered, very relaxed, and very present. It was like something inside of my body just called for my attention, and I dived into myself. I remember coming to the hospital without having sensed any kind of pain, and my cervix was already 8 centimeters open. I got into a bathtub, I played some amazing music, and I relaxed. And I could feel the head of my child passing through the birthing canal. And I could feel the head of my unborn child pushing on my G-spot. And it gave me such a deep, deep pleasure. It was almost sexual. I used the shower to pleasure myself, yes, I did that. And I enjoyed it even more. And I remember I told the father of my daughter, I wish you could be a woman and you could feel this, because this is really spectacular. The yoni of a woman is exceptional. In its natural state, it is between 8 to 9 centimeters deep. But when you're aroused, it can expand to more than 200% larger. During a birth-giving process, the main thing is to relax. If you allow yourself to follow the natural flow of your birth giving, your pussy will relax more and more. More and more. And it's the relaxation that opens the cervix. It's the relaxation that opens the birthing canal and expands so that the child can pass without any effort. Giving birth is an intimate dance between the mother and the child. There are different stages of the birth giving, like the first part of the birth giving is all about pleasure. It's all about relaxation. It's lying in the bed, listening to music, maybe making love, drinking tea, giving massage, enjoying yourself. The second part of the birth giving is more active. In this part, the child's head is passing the birth canal. And yes, this passage is quite small. And the child is moving inside. It is adapting itself. The child is always following the maximum pleasure while being birthed. So if it's tight in one place, it moves a little bit to fit better in the body of the woman, of the mother. And so the baby moves around itself. It's rotating around its own body to rotate out of the mother. And in this part of the birth giving process, it's important for the mother to be active and to be able to move. Maybe dance, maybe move the hips, do some yoga. Yeah, allowing yourself to search for the posture and the movements that will give you the most pleasure. Because searching for the movement and the posture that gives you the most pleasure will help the baby inside of you to feel the most pleasure as well, and to make space to be born. This birth-giving process, the first 2 stages, is an ecstatic experience. It's an arousing experience. And if you as a mother embraces the sexual nature of giving birth, there is a chance that you will experience orgasmic birth. To experience orgasmic birth, it's great to have a partner that can cuddle you, kiss you, touch your breasts, and increase the flow of oxytocin in your body. Oxytocin will aid the contractions and will help the delivery process to proceed forward. In the end of the birth-giving process, the head is just about to enter the world, and the skin around the vaginal opening is very tender and very sensitive, and it's full of nerve endings. And it's full of nerve endings in order for you to be able to feel that now it's tight, now I should relax more. So the last part of the birth-giving process, there is small pain appearing when you are pushing too much, with a risk to rip the delicate skin around your vaginal opening. So if you're just following the signals of the pain and allowing yourself to relax whenever the pain appears between the contractions in the last part of the birth-giving process, you will be feeling so relaxed, so much pleasure, so present. And then maybe the pain comes again as a small signal for you to don't push now, not yet. The skin is not stretched properly yet. But then once the skin has stretched enough, the whole baby can come out in a smooth and relaxed movement. I believe that it's a human right to be born with pleasure, to be born with love, to be born with joy. And I believe it's so important that we women embrace the fact that this is a possibility, that this is a way that we can give birth to our children. And it would change a lot when it comes to the connection and the bonding between the mother and the child if all mothers would give birth without pain to their children. It creates a deep, ecstatic, loving bond the first hours of life, which is so important for the rest of the life and for the rest of the relationship between the child and the mother. If the first experience of embracing your child would be embracing it in pleasure, in ecstasy and love. So I believe that we can actually change the world. We can make this world a world in peace when we are relearning how to relate to our yonis, how to relate to our bodies, how to relate to our sexuality, and to allow ourselves to develop a sense of pleasure and a sense of presence in our yonis.